Hey, it's Coach Taylor here from SmarterTeamTraining.com. I'm going to be honest, I have a Hall of Famer on the phone here, and the most impressive part is he's a gigantic, big-time dude. I've got an opportunity to go back and forth on email, talk to him a couple times, actually met him out of the presentation. I was speaking and look up, and to have a Hall of Famer, obviously, in the audience taking notes was really cool. I got a chance to sit in on the conversation afterwards, and I just had to get him on the show, man. I'm got to be honest, we went back and forth a couple times trying to create really good questions to discuss on this episode, and it's great to see a guy take some pride and show his passion about just providing good content on a platform such as this. So I want to say thank you very much to Rob Panariello for being on the phone, taking some time out of his day. I know he's on vacation right now, and that speaks even bigger volumes about who he is as a person and making time to get back to the field. And we'll go from there, man. Rob, I appreciate you being on the phone with me, my man, and taking some time out of your day, buddy.
No, listen, it's my pleasure. I appreciate you having me on the call.
Rob, I've done my homework, obviously, and checked out the website, read the blog, read your bio. Actually, obviously heard you speak, so I know a little bit about what you got going on professionally. But I want to know about you as far as a passionate person in the field, man. Can you tell me about how you got started in this field and really where your passion comes from?
I'm a physical therapist, and I'm an athletic trainer and strength and conditioning coach. Essentially, many years ago, I met Don Chu. And he was all three, and we developed a very good relationship. And he kind of introduced me into how, as a physical therapist, you can also become a strength and conditioning coach. And not to elaborate forever, but through the years, I've met guys like Johnny Parker, Al Vermeil, Al Miller, who've all been very close friends who have been integral in my education as a strength coach. And my interest is bridging the gap between strength and conditioning and rehabilitation of athletes, and it's always been my interest, and that's what I've been doing. So, in a nutshell, essentially, that's what I do.
I want to get into the heavy questions kind of quickly here, if you don't mind. Again, I listened to the conversation that you had there at the Juniata College event, and I think Doug Smith does an incredible job bringing in an awesome speaker, so I get a chance to sit down and take notes myself. And one thing you were talking about was actually the idea of how strength conditioning programs can lessen the likelihood of injuries or the potential for injury reduction, if we want to call it that. I mean, is there anything I should be doing in a strength conditioning program to help lessen the likelihood of an injury?
I think one thing that doesn't occur as often as it should is that I think we need to prepare the athletes better before we introduce them into the formal off-season strength and conditioning program. So something that we'll do is we'll use Javoric complexes, and if you don't know what they are, you can look them up online. And Steve Javoric just has a bunch of exercises and complexes where you'll select an exercise and you'll perform one after another, anywhere from 4 to 6 exercises. And we'll modify our exercises often, so we might do something like a muscle clean, to a high pull, to an overhead press, to a back squat, to a good morning, to a bent over row, and that's one cycle. You may do 3, 4, 5, 6 cycles eventually over time, starting maybe 15% of the body weight of the athlete, working up to 35 to 45%. And what this does over a period of time is a number of things. One is it increases range of motion and flexibility because form follows function, right? As we perform something, we get better at it. So we'll increase our range of motion, we'll increase our flexibility, we'll enhance our exercise technique by performing these exercises over time. We develop a work capacity so our athletes are better prepared to perform exercises one after another over time. And then we'll also increase, the strength of the athlete, though maybe minimal because the loads are so low, but the combination of everything prepares the athlete. So, okay, now we've got motion, work capacity, good exercise technique, and now let's have them go into the formal strength and conditioning program and start applying heavy loads at that time. So that's just one thing you could do. The other thing is I think you can follow Al Vermeil's hierarchy of athletic development. You've got to do an evaluation, right, so you know what your deficits are. You've got to establish a work capacity so that your athletes can do the work. You've got to develop strength before power because you have to have max force before you can generate max force quickly. Then you have to develop power before elastic and reactive abilities. And then last but not least is speed. You just can't jump across this continuum. One is dependent upon the other. I think another thing you need to do is you got to watch out for your exercise volumes. I think very often we just write programs and we try to include everything in our programs, and more is not necessarily better. And I think the combination of all those things, is integral in preventing injury. So again, just prepare the athlete before they really get into their formal program. And once they're in their formal program, really just watch your volumes, okay? And because I think low intensity and volume go hand in hand. When an athlete lifts a heavy weight, generally they make the lift or they miss the lift, all right? They generally don't hurt themselves. When an athlete comes into the weight room and says, my knee's sore, my shoulder's sore, etc., that's just too much work that they haven't been prepared for, performed over time. So in my opinion, it's volume that's the culprit for injury, not intensity. So prepare them well and then apply them into an appropriate program and watching your volumes.
I know that you're both a physical therapist and a strength and conditioning coach, and sometimes we get into that clinical versus in the trenches kind of conversation with people who do both. And I'm kind of curious, how do you utilize Olympic lifts and their numerous variations in both your clinical settings and then when you're also training athletes?
What has been taught to me, by, like I said, the mentors that I've had, I mentioned before, is that the bottom line is that the greatest athletes in the world are the ones that can produce the most force into the ground surface area into the shortest period of time. And so, again, going through that hierarchy of athletic development, developing strength and power, etc., we need to develop that in the rehab setting, and we need to develop that with our athletes when they're discharged from physical therapy. So we have to establish our strength base, and then once we establish our strength base, there are things that we can do in the rehab setting by exercising the overall body to help with the limb or the joint that's being rehabbed. So let's say you have somebody that has a knee injury. There's no reason why early in the rehab process, they can't do muscle cleans or presses in a standing position. You're not going to irritate the knee as long as that it's applied at the appropriate time. Once you establish your strength base, and in my experiences, most patients that are discharged lack the ability for rate of force production. Right? They lack power because it's not worked on. And whether it's actually performing the Olympic lift, and if you can't teach it, that's okay. You either learn or not learn. And some people have concerns with catching a bar. Well, there's no reason why you can't do pulls. And we know that if you do pulls from the mid-thigh or at the hips, you can use light weights. It's low. It's not very taxing. You're generating rate of force production. If you have a real concern, you can use bumpers, and at the height of your pull, just release, let the weights go back down to the blocks of the ground. And those are the types of things you can do. I think it's important that you Olympic lift from different positions. So let's just say you go from the hang or you go from blocks. A friend of mine, Lauren Chu, describes this as like a drag racer, right? We're starting from the dead stop, and essentially we're generating great torque, and we're lifting the weight. When we do Olympic lifts from the floor, that's important because as we go from our first pull to our second pull, we have acceleration. We have a preparatory movement that is occurring before we have an explosive movement. So the analogy Lauren will make is like a NASCAR racer. We're going around the track at a certain speed, and then we accelerate to pass our opponent. And both those aspects are very important in sport, and it's very important in the rehab setting as long as it's applied at the appropriate time, because our athletes need to start from a dead start. They need to be able to generate great force into the ground, great rate of force production, and they need to accelerate. The other thing that many people don't speak about with Olympic lifting, and while it's important to go from the ground, is that with the double knee bend, when that occurs, we get a stretch shortening cycle. We get a stretch reflex at the patella tendon and at the Achilles tendon. And that helps retrain our athletes because most athletic endeavors require a stretch shortening cycle. And then lastly, if we have a basketball player, let's just say comparing them to themselves, whether it's a male or female, if they take layups right-handed and can't take a layup well left-handed, and they practice with their left hand, maybe they still don't break the starting lineup, but as a basketball player, they're a better player because they can go from right or left. Well, same thing with the Olympic lifts. If you're teaching a different cast from different positions, hips, mid-thigh, knee, ground, then overall you're going to create a better athlete comparing the athlete to themselves because they've mastered multiple skills from different positions, which will also transfer on the field. So I think that generally in therapy, what often occurs, not 100% of the time, is that we don't have the power production or the rate of force production that our athletes could have at the time of discharge. And that's why I think components of the Olympic lifts can be applied at the appropriate times during rehab. And that's also why I think the Olympic lifts, for the reasons I mentioned, are very important in regards to the training of athletes. So I am a big advocate of Olympic lifts or their assistant exercises of the Olympic lifts, and those are the reasons why.
I want to bounce back and forth here between PT kind of conversations, strength conversations. I mean, you got a very wide background, so it allows my head to kind of go a bunch of different ways. I want to talk a little bit about the rotator cuff, and a lot of people kind of avoid the conversations about that. They normally stick to the ankle or the knee or some hip or low back type injuries. But I think the rotator cuff is a conversation that people need to be talking about a little bit there when it revolves around that upper body complex, we'll call it. I mean, what factors have you noticed that may indicate a potential for a rotator cuff injury?
Young people, young athletes, unless you're a thrower, they generally don't get many rotator cuff injuries. I mean, if they get them in training, I think generally, or in throwing, I think generally it's the overtax use type thing. I think, again, it comes down to preparation. If you prepare somebody for the task at hand, I'm quite confident that you'll reduce the incident of injury. So with rotator cuff, what we need to do is we need to restore normal motion of the shoulder. If they don't have that, we have to look at the thoracic spine, other things. We need a stable base for which the arm to move. So your scapular musculature has to be strong. And if you don't think you need a stable base to have good stability, to have great mobility, try shooting a cannon out of a canoe. That's an old saying, right? Versus shooting a cannon off a solid ground surface. Once you establish your scapular musculature, you also have to strengthen your rotator cuff. And the main function of the rotator cuff, although those muscles internally rotate your shoulder, they're to keep the head of the humerus in the center of the socket or the glenoid. They fight the opposing deltoid musculature from driving that head superior into the inferior aspect of the acromion and having impingement type activities. Okay? So if you're stable in the scapula, and your scapular position is where it should be, your rotator cuff keeps you centered, then the third thing you need is good normal neuromuscular timing, right? Because for every there's a relationship between motion between the scapula and the rotator cuff. So for instance, what you're taught in school, in physical therapy school, if you raise an unweighted arm overhead from 0 to 30 degrees is a setting phase. From 30 to 90, there's 2 degrees of humeral elevation to 1 degree of scapular rotation. And then from 90 to 180, it's 1 to 1. So your total overhead movement is 120 degrees of humeral elevation and 60 degrees of scapular rotation for 180 degrees of motion. But that is a rhythm that has to occur specifically so that the head of the humerus always maintains contact in the center of the glenoid. So if you had to work on certain things, it's timing, it's strengthening of the scapula, it's strengthening of the rotator cuff so that it maintains the head of the humerus in the center of the glenoid, so it offsets the pole of the deltoid, and then it's avoiding excessive work. It's avoiding fatigue because fatigue is a detriment to performance.
I'd like to talk about the concept of the heavy lifts in season in particular. I mean, off season we can control some of the variables in life, if you want to call it that. But in season, man, there's just so many things that go about, through games and practices and getting nicked up and that type of thing. I mean, how do you program heavy lifts in season?
First of all, I think a lot of people do not lift in season. And the reason why they don't lift heavy in season is because of the added stresses of practice and game day competition. And I'll give you a little bit of a background why we got to this. So years ago in the off season, I used to work the off seasons with Coach Parker of the New York Giants. We used to talk about things, and then eventually he went to other teams. And when he was with New England, he had the idea to lift people heavy in the off season. And long story short, even with the Giants, he would call the season his laboratory. And so, as you know, when you're in the NFL or any league, but let's say the NFL, you play each opponent twice. And he would get reports from his players that they felt much stronger when they played the same team in November or December than they did when they played in September. And it may have been a factor that the Giants lifted heavy in season or New England lifted heavy in season, and the other team didn't. When he was with New England and they went in eventually in their Super Bowl loss to the Packers, they had 35 players set PRs in one lift, or at least one lift, going into their first playoff game. So now you think about this. When we train off season with our athletes, we have guys hitting PRs, we go heavy, and maybe that's the only thing they have to do. They have to lift, they have to run, etc. But they go heavy, and they enhance their athleticism so that later on when they practice, that athleticism can transfer to their skill, and they enhance the physical qualities necessary for sport. And there are standards in sport, right? We know that football players have speed standards, strength standards, power standards, etc. You could just look at the combine, right? They look at standards. So at the most important time of year, when we're playing the game, why do we not want to keep maximum strength, power, and speed abilities? Why do we limit the loads we lift because of practice and game day competition? Now, we're not going to put anybody at risk, and we're not going to be foolish. But if you look at the whole program design, so now you've added practice and now you've added game day competition, but if you produce low volume, high intensity work, your athletes will stay strong and powerful. So think about it. When someone goes for a PR in a lift, they may warm up, then they may do a set of 3, a set of 2, maybe a couple singles, and then they go for their PR. When they're done doing 10 or 12 reps, are they overly fatigued? They're not, because it's volume that's the culprit. It's not intensity. So during the season, if you program your lifts, and let's say an exercise only has 12 reps in its performance, you can do singles at the end of your exercise at 90% or better. And you will find over time that your athletes will not become over fatigued, but they will maintain or even get stronger during the course of the season. And if you think about off-season programs, there's so many off-season programs where people are going to enhance their physical qualities and their athleticism, that maybe in-season training is one of the last advantages that we have. So I'm an advocate, and we've done it for years, of heavy in-season training at the appropriate times. You still need to cycle the program when you can. You still need your off days. You still need your low volume weeks, as you would in any type of periodization concept. But there's nothing wrong with it at the appropriate time in season to lift heavy loads, because if you don't, how are you going to be strong 3 months from when the season started if you limit yourself at 75% capacity? It's just not going to happen. You're going to lose your strength. The other thing I want to finish with this is people talk about keeping their athletes fresh, and we have to rest our athletes to make them fresh, right? That's a lot of concepts that position coaches or head coaches have. And I agree. There are times where your athletes need to recover. They need to rest. There are weeks in your off-season or in-season program that are unloading weeks. But the way you really keep your athletes fresh is by keeping them strong. And if you look at teams that win championships, it's not only because they have the horses, but the horses continually play day in, day out. They have low injury rates. And the stronger and the more powerful you can keep your athletes, I would bet the chances are that you're going to keep them on the field of play, because they will resist the stresses of a long season better by staying strong, not by resting.
I'll be honest with you, leading up to this episode, I had a couple people reach out to me just because I like trying to get a little bit more information about people's background. And one thing people were constantly asking me about was to talk to you about ACL rehabilitation and some of the things that you're doing that are kind of unique. I mean, what can be implemented during an ACL rehabilitation that would better prepare an athlete to return to training practices and games?
Lifting weights happens in rehab as part of the rehab, and lifting weights happens in training, okay? And so I go back to Vermeil's hierarchy of athletic development, right? Evaluation, work capacity, strength, power, elastic reactive abilities, and speed. So we have to get our athletes strong, all right? So again, have them exercise not only the limb involved, but the rest of the body. So I spoke before, if it's a lower extremity, have them do muscle cleans, have them press overhead, have them work the opposite extremity. If it's an upper extremity, have them work their lower extremity. The overall body strength will help assist with the rehabilitation of the extremity or the joint involved. So with the ACL, we do that. With the ACL, we pull. We've gone over that already. And I will tell you this, that there is research out there that shows that mid-thigh pulls take about 150 milliseconds. Most athletic endeavors take 200 milliseconds or less. So there's a specificity of time as well. Again, rate of force production, force into the ground. So we'll strengthen, we'll pull, people will start to squat. I'm a big advocate of the squat. We did a study back in the early 90s that was published in the American Journal of Sports Medicine in 1994, Coach Parker and I. We measured the knee ligaments, the ACL and the PCL, of 38 or 40 New York Giants football players as they lifted over 21 weeks. All right, so we tested them initially, we tested them after 12 weeks, and then we tested them again after an additional 9 weeks. And after lifting thousands of repetitions in deep knee bend positions, not just squatting, but catching on your clean, snatching, etc. And guys like Joe Morris, who at 205 squatted over 600 pounds. So Joe was typically squatting twice his body weight continually, right? Squatting to 400 pounds for reps was no problem for Joe Morris. Guys like Dave Meggett, etc. So you had a lot of guys that would have high averages at twice their body weight. And we did 2,448 tests. And of the 2,448 tests that we did, knee ligament tests, only 8 were abnormal. So we know in normal ACLs and normal PCLs that we don't stretch them out by squatting and doing these things through heavy loads. My concern with squatting is not the ligament. My concern with squatting is concomitant injuries. Is there a posterior horn of the meniscus damage or repair? And I worry about the patellofemoral pain. But again, form follows function. If you prepare the athlete and if you're a good coach, you teach them how to squat properly and you take their feedback and you watch your volumes, I think all these things work hand in hand so that your athlete will be able to squat, will be able to Olympic lift, will be able to do the things you need them to do. The other thing is there are standards in sport, as we already spoke about. So if our athletes do not meet the standards, the physical qualities of strength, power, speed, that are required for them to play the game, then are we putting them at risk when they return to the field of play, which was the arena where they got hurt in the first place? So we have to prepare them for that arena. And we prepare them in an environment of control, right? As strength coaches or physical therapists, we can watch our loads. We can select our exercises. We can control our volumes. We control nothing on the field of play. So we have to stress them. You know, Hans Selye and his work, we have to disrupt homeostasis. We have to stress them for adaptation. And if we're afraid to stretch them and stress them in a controlled environment, how are we allowing them to return to the field of play where we control nothing? So that's what I think you have to do. You have to load them, and you have to load them appropriately and at the right times. That's the first thing. The other thing with ACL reconstructions is that I think most people get range of motion back of the knee and the hip and everything. They get it back passively. They don't get it back actively. And so when the athlete starts running, their heel position from their buttock to their heel is at a specific distance that the lever arm is great, and they can't get their heel up at their butt. They're like around 90, 100 degrees. And so what happens? Well, running is a cycle. So if you screw up one part of the cycle, you screw up the whole thing. If you screw up the swing phase, you screw up the stance phase. If you screw up the right leg, you screw up the left leg. And so the inability for the heel to get to the butt has an effect on the backside mechanics going forward. And so what will happen is that the foot will pass below the knee too low, and you'll actually get a breaking or a friction as well as throw off the cycle of running. And I've spoken to some sprint coaches, and they think that concept is about, it'll cost you about 1/100th of a second off your 40. Let's just stick to the subject of football. Well, if our guy is going to take 18 strides in a 40, and we screw up 1/100th of a second per stride, that's 1.8 seconds due to biomechanical disadvantage. So we have to restore the proper foot position on the backside mechanics at the butt. And we just can't do that by passively stretching and achieving passive range of motion of the knee. We have to get active range of motion. And how do we do that? We'll do things when appropriate, like butt kicks and mock drills, right? A-skips, things like that. We've got to get this leg cycling again and assuming those positions. The other thing that I think we need to do, and that we do early on in our rehab, is that we have to establish the integrity of the Achilles tendon. You know, when we talk about sprinting and elastic abilities, after we get through our start acceleration and we increase our speed, elastic abilities start to take more of a dominance. And so a lot of elasticity comes from the Achilles tendon. So early in our rehab, or at appropriate time, because everybody's different, we will start ankling type activities. And when we do ankling, or even modified ankling, essentially we're starting to stress and get the Achilles tendon used to making contact and producing force off the ground surface. So you have to establish loading, right? Whether it's a strength or power. You have to reestablish the heel to the buttock in regards to active range of motion, so that you've restored the normal backside running mechanics, and you have to restore the ability of the Achilles tendon to appropriately push off the ground surface area with an elastic ability. And if you could do all those things in rehab, that's that much less time the strength coach has to spend restoring the athlete to doing those things, and thus they can focus their time on advanced drills, advanced strengthening, and advancing the physical qualities that will meet the standards of requirement to play that sport. So those are examples of the types of things that we do that I think are important.
I know you've had the opportunity to coach for a while. You've had an opportunity to be in the clinical setting for a long time, and you actually also put yourself out there as far as helping teach and give back to the profession by presenting all over the place and speaking. It's awesome to see your name on the list and the docket at a lot of different places around the country, to be very honest with everybody that's listening. I mean, my question to you is there one big motivational message that you'd hope to share with people when they come to listen to you talk or speak or even come visit you and to learn from you kind of as a mentor type scenario?
I believe you have to give back. You know, I'm at a point in my career, I've been doing this over 30 years, and just like, you know, like I said, the Al Millers, the Al Vermeils, the Don Chews, the Derek Hansons, the Johnny Parkers, the Charlie Francises, all the guys that have given to me, I owe it to them to give back. So I'm not hesitant to tell anybody anything I know. I certainly don't know more than I probably do know, because of the old saying, right? The more you know, the more you realize you don't know, and you have to find out. I think the advice I would give people is that, know the difference between fact and opinion. There's a lot of opinions out there, but coaching is an art, but the art has to be substantiated by science, all right? We have to know why something works, because if we don't know why something works, then A, how do we know how to use it? And B, how do we progress it? So know the difference between fact and opinion. I think that, trainers or people and physical therapists should develop their relationships with their strength coaches, and their strength coaches should develop the relationship with the rehab professional, whoever they may be, because it's two different professions, but there's definitely an overlap. And there's certain things in rehab that we don't get that the strength and conditioning coach can teach and can help us in regards to, hey, that's a great idea. We can't do that, but we can modify that. And then also the strength coach can learn a lot from the rehab professional, stating, I was going to have this guy perform this type of exercise, but you're right, we do need to modify it now that I realize the precaution that's needed after this type of surgery. And, egos have to go to the side, because it's not about the rehab professional, it's not about the strength and conditioning coach, it's about the athlete and what's best for the athlete. So I would just say, learn whatever you can from as many people as you can. And, there's an old saying, some decisions you'll make and some will be made for you. And throughout your career, that will occur, and hopefully, you do well enough that it's very successful for you. I don't know anybody who wouldn't want someone in demand who is very knowledgeable and very skilled at that profession, right? If you had to have bypass surgery, you want the best cardiologist. If you want to build a house, you want the best construction guy. Well, if you're a very good physical therapist or athletic trainer or chiropractor, or you're a very good strength and conditioning coach, you'll be in demand. And so how do you get there? You get there with knowledge and skill. So do whatever you can to get that knowledge and skill.
Again, Rob, man, I applaud all your passion there for sharing information and giving back to the field. I'm sure there's people that have questions about some of the things we've talked about here on the show, or even maybe they missed your contact information at one of the presentations. How can someone go about reaching out to you to learn more about what you have going on, to just talk shop about strength conditioning with the physical therapy side, the rehabilitation side of the field, or if they're working with an athlete, or even just to reach out to you as a mentor?
They can feel free to contact me. It may take me a day or two to get back to you, but I try to get back to everybody I can. My email is rpanariello, Panariello @professionalpt.com. That's our company, Professional Physical Therapy. You can check out our website at professionalphysicaltherapy.com or our performance center at papcstrong.com, and leave messages either on the websites as well. And once, I get your email, if I get a question, I'll obviously do my best to get back to you within 24 to 48 hours. That's not a problem.
Again, anybody listening to the show here, I would strongly suggest you connect and network with Rob. If you get a chance to see him speak or present, walk up, shake his hand, make sure you introduce yourself, because this dude has a ton of knowledge about things going on multiple aspects of this field. I'm looking forward to you becoming a resource of mine on a regular basis, Rob, and I'm hoping that this is an opportunity for us to do some things down the road and really gives us an opportunity to have a launching pad to really create a big-time impact in the field as we move forward.
Rob, it's my pleasure. Anything I could ever do for you, I'd be more than happy to. I appreciate your time, and I appreciate you having me on.
Thank you very much, man. Enjoy your vacation. I look forward to keeping in touch, big dog.
All right, thank you. Take care. Bye-bye.